Title: Sugar Substitutes and Cardiovascular Risk, Unraveling a Troubling Paradox for Indian Health. TLDR, health experts caution that artificial sweeteners, often considered a healthier alternative to sugar, may increase cardiovascular risks. Despite their common use amongst diabetics and those battling obesity, recent studies and WHO guidelines suggest that these non-sugar sweeteners might enhance the chances of stroke and heart attacks. Questions around safe alternatives and individual health implications abound. Reporting: the quest for a healthier alternative to sugar has led many, especially those grappling with obesity and diabetes, to artificial sweeteners. While initially touted as potential game changers in managing blood sugar levels and body weight, recent research and guidelines from the World Health Organization, WHO, point in an unexpected direction. They may lead to an increased risk of cardiovascular events. The question now surfaces: have we been inadvertently trading sugar for an unseen danger? The statistics are unsettling. Various studies reveal that these sugar substitutes, known as non-sugar sweeteners, NSS, can elevate the risk of stroke and heart attacks by 9%. This paints a concerning picture for the large number of individuals using these products as part of their daily dietary intake. What's the science behind it? According to Dr. Ajith Deer, Director and Head of Cardiothoracic and Vascular Surgery at the Fortis Memorial Research Institute, one factor could be the effect some sweeteners have on clotting agents. They can potentially enhance platelet aggregation, a key step in clot formation that can lead to heart attacks or strokes. Another theory is that these sweeteners can trigger inflammation in the gut, which, in turn, leads to unhealthy vessel walls. For those already at risk due to diabetes and hypertension, this only adds fuel to an already precarious fire. Are these risks worth the perceived benefit? Certain artificial sweeteners, such as aspartame, are more linked with stroke risk, while others, like sucrose and stevia, have more association with cardiovascular diseases. The revelations on artificial sweeteners don't stop there. These substances may also lead to dyslipidemia, abdominal obesity, high blood glucose, insulin resistance, and hypertension. Alarmingly, saccharin use has been connected with a higher risk of bladder cancer, albeit the supporting evidence is limited. How much are we willing to risk for a sugar-free life? Short-term weight loss benefits from NES usage have been noted in systematic reviews. Yet, there's a glaring absence of evidence supporting long-term benefits in reducing body fat. Instead, undesirable effects of long-term NES use have surfaced, with increased risk of type 2 diabetes, cardiovascular diseases, and mortality among adults. In response to this emerging health challenge, experts in India are calling for local guidelines on NES usage, reflecting the growing consumption rates. As we grapple with these findings, the search for safer alternatives continues. Dr. Charu Dua, Chief Clinical Nutritionist at Amrita Hospital, Faridabad, suggests a return to natural sources of sugar, such as fruits and dates. However, given the complexity of diet, lifestyle, and individual health conditions, what could be the universally safe and healthy choice? First seen on Can, India. With these revelations, how should we approach sugar substitutes in our diets, and what changes do you think need to be made in health guidelines around the world to address this issue?